Hi, and welcome to Beyond the Pelvis. I'm Laura Haraka, a somatic practitioner, breathwork facilitator, and someone who's been on the healing journey myself. I know what it's like to live with chronic symptoms and feel disconnected from your body, and I also know how powerful it can be when we start to listen, slow down, and heal from the inside out. On this podcast, we talk about the mind-body connection, nervous system healing, pelvic health, and all the messy, beautiful layers that come within learning to trust your body again. Whether you're brand new to this work or deep in your process, I'm so glad you're here. So let's dive in. So welcome back to another episode of Beyond the Pelvis. Today, I am honored to have a friend and a colleague, Scotty Stiles, here with me today. Scotty is a pain elimination coach and mind-body practitioner who helps clients worldwide overcome chronic neuroplastic pain conditions. Using pain reprocessing therapy and other mind-body tools, Scotty guides people toward lasting relief by addressing the true root of their symptoms. His approach is deeply informed by personal experience, a healing journey marked by setbacks, breakthroughs, and powerful nervous system regulation. Today, he helps others reconnect with safety in their bodies and lives, showing them that healing is possible. Welcome to the podcast, Scotty.
Thank you, Laura. It's so nice to be here, and it's great to finally be on your podcast. It's an honor to be able to share this, the message of the story that I have with your audience, and just to help anyone listening.
Awesome. We're so happy to have you here. So I'm wondering if you can just start out and share a little bit about yourself, your story, and what brought you into this space.
Right. Well, like so many people, I think I came into this space not really realizing that this is where I would end up. I suffered from years and years, probably 15 years of debilitating back and hip and pelvic pain, as well as a whole list of other symptoms. And, I think back and it's hard to really pinpoint when the pain started, as many people can relate to, but certainly I had moments of just sharp pain as a teenager, growing up and whatnot. And, the pain would kind of come and go. And I just thought it was normal. I just thought, oh, people get pain. And, my grandmother, she had severe pain, and she was told it was osteoarthritis. And I just thought, okay, well, people in their 60s and 70s, they just have pain. That's just what happens. You just get older. So I think that was maybe like subconsciously imprinted in my mind that I should be feeling this way. I should have pain because my grandmother has pain. And maybe even I made these like conclusions and pain beliefs that, it's genetic on some level. Well, oh, okay, I have my grandmother's bad back, in quotes, bad back. And so it kind of all started with that, really. If you think about it, it was like my subconscious brain was primed and ready to look for pain my whole life. And my grandmother, who I adore and empathize with, and seeing somebody in pain, of course, is programming my brain to not want that very thing that she is struggling with. So, as a teenager, I thought, oh, well, that thing of getting older is happening. I'm only, 17?
Right. I have clients in their 70s and they say, oh, well, this is normal because I'm getting older. And I tell them, oh, don't say that. It's a mindset.
That's right. And of course, as Dr. Sarno, our famous pioneer in mind-body medicine, says, aging is not the cause of pain. It's the years of responsibility, which are the years between 30 and 60. Now, of course, pain can happen outside of that. It was clearly happening to me as a teenager. But of course, I had no understanding of what that was until things got worse. Yeah. And so the years progressed, and I would have these sort of acute flare-ups. I would just think, okay, well, I need to go have bed rest, thinking that would help, and just be at home and not work for 3 or 4 days. And sure enough, I would get better. I don't quite really know why that was. Probably just, removing myself from life and just the belief that I would heal, thinking that I was doing something structural structurally healing the pain by just laying there. In retrospect, it was probably, some element of, giving my nervous system safety by just kind of taking time off from work. Maybe that could have been it.
Right. So this laid you up for sometimes 3 days at a time, this back pain.
Yeah, absolutely.
Mhm.
Yeah. The craziest things, right? It's like, lying at home on the floor with your legs propped and doing this whole, like, I'm going to circulate my, legs and raise those and lift those up and put on, heating packs and take on all these, over the counter medicine and things like that. And yeah, and then into my 30s, it was just kind of happening more and more frequently. There were moments where I would go to the emergency because, the pain just being there off and on was kind of normal to me again, right? Thinking, well, pain just kind of increases, or sorry, pain just kind of is normal, right? But when it turned up to like a 10 out of 10 volume, the anxiety and panic that I was feeling in my nervous system, which in hindsight makes perfect sense, it was just this sort of sympathetic energy, was literally speaking to me and saying, you're having an emergency. You need to go to the hospital. So the pain was really that bad. This is beyond the pelvis pain podcast. And so, I had this one moment where I did have some pelvic pain. It's funny actually. I was thinking recently, like I've always had pelvic pain, but I never really called it that because the pelvis is made up of more than one area.
Mm-hmm.
So I had mostly back and hip pain, but that is still part of the pelvis. Anyway, this one day I was working in hospitality and I had the pain kind of moving from the back and hips into the groin area. So,
Mm-hmm.
maybe that is more traditionally seen as the pelvic area.
Can you
And
describe a
so,
little bit about what was happening for you with this growing pain?
yeah, it was just intensifying and gripping and stabbing, and it had moved, right? So I thought, well, something is more wrong now. It's not just my back, it's not just my hip. Now it's in my pelvic area. So I went to the ER thinking, well, something has to be done because maybe it's not just this normal aging pain that I'm having. And so, I go to the ER, and it's funny, they ask you all these questions to make sure it's not a really serious medical thing. And they asked, do you have any pain in your stomach? And I said, well, yeah. So at this point, it was kind of hard to even determine, where is it? Is it in my back? Is it in my hip? Is it in my pelvis? Is it in my stomach? So I just answer the question, yes. And it's funny in hindsight because when you say you have pain in your stomach area, it could be a risk of appendicitis. So they actually rushed me in faster, and then they had to rule out appendicitis, which it wasn't. But the pain was so extreme that it was just completely enveloping my whole body. And then the doctor, prescribed me anti-inflammatories. That was it. That was all they did for me. They didn't know anything about the mind-body connection. They didn't have any answer really. And so I was just kind of left hanging. And so
Did
this,
the
medical merry-go.
anti-inflammatories work?
I think so. They did and they didn't, right? They worked in that moment for that week, perhaps. And then the next time the pain came back, I went to my own doctor and asked for similar medication. And then, he gave me whatever he gave me at the time, and that did not work. He also prescribed SSRIs, which in hindsight is quite funny because it's like working with parts of the brain. That medication is sort of meant to calm your anxiety and impact different parts of the brain. Yeah, so this merry-go-round went on for years and years and years, and it was 10 years ago. In fact, we share a similar date, May 2nd, 2015. I kind of had to sort of come to grips with what was happening for me and essentially come out by saying, I have chronic pain. I was kind of in denial of it for so long. Like I knew I had pain, but I wasn't really talking about it or sharing it with anybody. So at this point, I had to say to my employer, I had to say, I have to stop working. I am in so much pain, I can't be here anymore. So that was May 2nd, 2015. That was a pivotal day because it just meant that I really needed to find a solution and be honest with the fact that I was struggling. Now, I didn't start the mind body healing journey until 2 years later, but at least I was moving to that next step. So I had an MRI. They found a whole bunch of incidental findings, right? They were normal abnormalities that I know now. But at the time, I was told that the cause of the pain was from spinal stenosis, femoral narrowing, bulging discs, all of these scary sounding things. And, the surgeon said, well, you're not really a candidate for surgery. We can do injections and we can send you to a sports medicine clinic and try all these physical modalities, which I did. And turns out none of those things helped. And furthermore, what the surgeon was saying was the cause of my pain was just a correlation. It wasn't really the cause. Those were incidental findings. Those were, as Dr. Sarna would say, normal abnormalities. Pain-free people have all of those same findings on MRI as I did. And I have no pain now. I don't have any of that back, hip, pelvis pain anymore, but I'm sure my MRI looks the same, or if not, in quotes, worse
Right.
by biomedical standards. Yeah.
Yeah, yeah. How were you treated by the doctors when you went in?
Mm. Yeah, that's a good question. My GP is fantastic. It's interesting because I talk to him now and I say, why is it that, you never told me about this? And he said, well, from the doctor's perspective, a lot of patients aren't receptive to it. And so, in hindsight, he did kind of do what he could with referring me to therapy for anxiety and things like that. But it just still didn't make that connection that treating your anxiety and seeking therapy is also a solution for healing physical symptoms. So he was kind of almost there, but not really quite fully there. And then the surgeon, he had horrible bedside manner. He seemed very sure of himself in a very kind of condescending way, and didn't really make eye contact with me. Didn't really want to help me. It seemed, because people are desperate. I think they probably get that a lot. That people are coming in desperate, like, what do I do? What do I do? And he is just, was just kind of flippant and saying, well, you can go to this sports medicine clinic and you can do this thing. And those things, again, those things helped for a bit. And so I was doing these things off and on for 2 years that were helping, but not for the reason I thought they were helping. They were helping because my brain believed that I was receiving some sort of, medication through, some sort of release of pain through physical modality, but that was just my brain's belief that that was helping and not the actual physical modality.
Right. Your brain probably felt a little safer that you were doing
Yeah.
something for your body, doing something for your brain.
Exactly. Yeah, the sports medicine thing, going to these classes, almost like kind of like yoga classes, and you go and you try these different postures and you stand on your feet with, 40% of your weight on the balls of your feet, and then 60% on all of this like really fine tuning of posture and all this stuff. And it's funny because after 8 weeks of doing that program, I started to feel better. And I thought, okay, I'm good. That actually helped. And then I went back, 6 months later with even worse pain, and then tried the exact same thing that worked, in quotes, the first time. And it didn't work anymore. So I'm thinking, well, why is it not working this time? So that kind of makes sense now in retrospect too, that it was all a placebo. It was my brain's belief that something was helping. And that's why that actually helped originally as well.
Yeah. So what happened next in your story? How did you
Yeah.
decide that, you were going to, pursue this mind body? What was the missing link there?
Yeah. So I first discovered Dr. Sarno in 2015. And like many people, they hear about it and they think, but then they start to lose hope and maybe turn back to the physical modalities. So like this is so very common. And if anyone's listening and saying, well, maybe I could try this Dr. Sarno thing, maybe I could try this neuroplastic pain thing, but I do have this MRI, this is the fence that we want to get off of. And it took 2 years to really just, try everything. And Einstein said, insanity is doing the same thing over and over again and expecting different results. And that's what I was doing.
Right.
So after literally trying everything short of, getting an inversion table and hanging myself upside down, I was actually hanging from trees at one point. I would look around, and if I saw a branch I could just hang off of, I would do that. Anything to get relief is what I was looking for. It
Oh
was
my God,
wild.
you have pictures of yourself hanging on trees?
No, I don't have any, but I should recreate it. I should do like a, this is me in the past, this is me
Sure.
now. But yeah, so I knew about Sarno. He was on my radar in 2015, but I still got swept away by the biomedical things and everything I was hearing in society. Everybody saying, well, does that mean the pain's in your head? Well, oh, okay. And then I felt like I needed validation and say, oh, I have this MRI and, this is why I'm in pain. You feel bad for me, not really consciously, but subconsciously, I'm thinking like people don't understand what I'm going through. So if I can say, I got this MRI, then they're going to believe me. So in 2017, I was in a used bookstore here in Toronto, and I saw Dr. Sarno's book, The Mind Body Prescription, and it was just calling to me from the shelves. And I thought, this is it. I have nothing else to lose. I had just been on vacation in London, England, and had the worst time because I was in constant pain. Some days I didn't leave my Airbnb until 5 p.m. because I was in so much pain. And that's not
Right.
really a life to be living. And so yeah, I took the book out and I said, this is it. I'm going to commit. And part of the treatment, as Dr. Sarno would say, is to, well, first of all, resume all normal physical activity and accept the diagnosis, and to give up all of those other things that aren't working. So I was, I had to kind of wean off seeing the osteopath. I think I did that within a couple of weeks. No more physiotherapy, no more massage or chiropractic. And I really stuck to it. And that's where it all began. And it took me, I never want to give a timeline, but first moments of healing were really happening in the first week. And that's how we know, right? It's if you have a reduction in pain because your brain is feeling safe right away, that's pretty amazing. So my back pain completely went away in the first week, and then it came back. And interestingly enough, when it went away, I got dry eye. I got this really excruciating, like feeling like there's something in my eye. And so that was when I started to experience the symptom imperative phenomenon. And luckily I knew what it was because I understood Dr. Sarno's work.
Mhm.
Interestingly enough, in hindsight, I had many symptom imperatives before finding out about TMS because I had other symptoms like shoulder pain and foot pain and anxiety and so many other things. So yeah, I found the work, I committed about, 5 months in or so, I discovered Journal Speak on Nicole Saxon's work. And then I just, things took off from there. So much healing happened after I found expressive writing and really connecting to the parts of me that were making my brain feel unsafe.
Right. Yeah. You mentioned once you committed, you started seeing results after a week. And what I find with some of my clients or people that contact me, they say to me, it's not working. But part of the issue is they're still on the fence.
Right. Absolutely. And sometimes we're on the fence and we're subconsciously on the fence. We're not even realizing we're on the fence. Yeah. So, our own brain can fool us at any point in time in our journey. Even being an expert and a mind body coach now, I've had symptoms years later that have where I question things. It's only natural. Your reflexive instinct is to think, is this an emergency? Is this a medical issue? We want that. We want our brain to kind of alert us to danger, but
Right.
then we have to do the job of unpacking, well, is this medical or is this neuroplastic?
Right.
And even I think it was 2021. I was struggling with repetitive strain injury in my shoulder from swimming every day. It was COVID. I wasn't working, and I was just swimming, 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 and then my shoulder was so tight and sharp, and I wasn't able to swim anymore. And I thought, okay, well, maybe I should go to the PT for this. And sure enough, I was fooled by this pain again. I thought this was structurally caused because I was swimming. Well, it
Exactly.
turns out repetitive strain injury is also TMS. It is also neuroplastic. And so it's just baffling how it can this being on the fence can come up at any time. And even lately I would have I've had post-viral symptoms, overcoming a virus, and the symptoms are still there. And I'm thinking, well, something's going on, a month after healing from this virus. And we need to get medically checked out. So I did. I went to the doctor and did a chest x-ray, and I had bronchitis and whatnot, but it was now no longer there on x-ray. So what's going on here? Some sort of hanging healing is happening. And so that was when I kind of had to come to terms with it and say, I need to accept this as a diagnosis. I need to accept that it's TMS. And sometimes that's harder. Sometimes we wish I just wish it was structural this time. And then so it's funny because if I get a new symptom, which happens, I'm human, but it doesn't mean it's going to be chronic. I'll think, oh no, this might be TMS, knowing that it might be a little more challenging to commit. It might feel a little more scary just to say, I have to go and face this now. I have to go head on this symptom, because it would almost in some ways be easier to just take a pill.
Absolutely. And I love how you said that you still get symptoms sometimes, because we are both mind body coaches, and we are not immune to getting symptoms. It's part of life. And pain can be a normal part of life, not chronic pain, but pain in general. So it's, I think, really important for people to hear that sometimes, even as coaches, we can get symptoms too. I remember you said from a virus. So when I first had COVID for the first time, I started having symptoms way after I was better. And I had to basically, I called it TMS myself out of it,
Ah,
right? I had to sit and do the work.
right. Yeah. And maybe there was some resistance too when you first had that realization, like, no, I have to do the work, right? It's hard to face it. We almost just wish it wasn't happening. And so by that very act of not wanting it is kind of repressing the fact that we're in pain. And then we think, wait a minute, there's something going on here that I'm not facing.
Exactly. Exactly. So I think it's really important to tell our clients too that it's also okay to go to a doctor. We need to
Mhm.
make sure if we get a dry eye that there's not something going on with our eye, and
Yep.
then rule out the medical diagnosis, and then we can proceed with TMS guidelines.
Yeah, absolutely. And the more people get in touch with their nervous system and how, these newer symptoms or symptom imperatives might be occurring in their body, the more trust that they'll have in the process, right? The more symptom imperatives I've had, the easier it's been to recognize them for what they are. It's funny, I had a symptom imperative of really excruciating foot pain, and I know exactly what triggered it. This is a wild story. So I was speaking with my partner one night, and I just, I was explaining how I was just so passionate about sharing this mind body work with people, and that there's somebody that I love in my life that has really bad foot pain, but just might not see that this is what's happening for them. And that kind of, made me a really kind of like, oh, I really want to change this, but we can't always change people that are not fully there yet, as we know.
Right.
But anyway, so what I kind of said off the cuff was, well, I never get foot pain. Well, guess what happened the next day? My brain sent me foot pain. So whatever psychological, emotional, current was going through my body kind of latched onto this idea of what would it be like to get foot pain? Right? It's totally subconscious. And through predictive coding, my foot just lit up. All the neural circuits just started lighting up. And then just a twinge is all it takes. And then the brain can take off with that. And then it's that, oh no, I don't want this foot pain. Oh no, now it's growing and expanding. Oh, well, this is neuroplasticity. What we focus on is growing and expanding. And this foot pain lasted for months. It was coming and going as a neural circuit that could get my attention for over a year. And it was always kind of, waxing and waning based on the sympathetic energy in my nervous system. I could feel it. I could feel in this heart space. I'm touching my chest right now, saying I could feel the sympathetic energy, and I could feel the foot pain, and I could feel them kind of, almost like there's this connective line between them, which was kind of, helpful in healing it, because that is what we do in a lot of this pain reprocessing therapy work, is we speak to these parts of us that feel scared, because that's what, where we're feeling our brain in danger, and it's very much in the body. And then, through somatic tracking and other practices, and believing that there was nothing wrong with my foot, because I knew I didn't bash it in the door, and I knew that I didn't sprain my ankle. I was so confident that this was neuroplastic. So, I didn't need to have it checked out, because I was just so confident at this point, this was behaving as neuroplastic. I declared to the world, I never get foot pain. And the next day I got foot pain.
Right.
What is more certain than that, right?
And that can happen when we're coaching. I've had those experiences too, where I've had a client say something to me and I say, oh, I wonder what that feels like. I haven't had that. And then all of a sudden it shows up. And now I'm getting much better at blocking myself energetically. Or if it does show up and it's something I never had before, giving it back to the universe, back to the client. So we can trigger these experiences for ourselves. And sometimes it is just an inner knowing if it is TMS or not.
That's right. Yeah. I've had that same experience on calls with clients, and, so many symptoms, and the brain is just doing that. It's just always scanning for danger. So of course it's going to do that on a somatic level and say, do you feel pain in this area too? I'll be doing a somatic tracking with a client, and we'll be working on that specific symptom that they have. And I will be paying attention to that part of my body and notice that there's tension there. And I'll even say that to them. I'll say, well, now I have neural circuits lighting up in this part of my body. Now that we're talking about this, obviously my brain is focusing on it too. I mean, our brain has the ability to focus on all sorts of things at different times if we just tell it what to do. Like, I'm focusing on my feet right now and how they feel on the floor, and it feels soft and nice. And so yeah, I will have that, and sometimes I will have a symptom popping up on a call, and I'll even admit that to my clients, and I'll just say to them, the fact that I'm aware that this happens is actually going to make me less frightened when it does. And then sure enough, by the time the call ends and I move on with my day, I'll say to them confidently, I know it'll go away, and it does, because I don't add any more fear or meaning to it than needed, and I normalize the fact that we can create symptoms simply through belief, right? Belief in harm leads to harm, and belief in well-being leads to well-being.
Exactly. Oh, I love that. That's beautiful.
Yeah.
That's beautiful.
I
I'll
feel like
share.
Dr. Schuminer, that I think that's one of his quotes. Belief in harm leads to harm. Yeah.
Yeah, it might be. It might be. I might have heard him say it, but it's still beautiful hearing you say it as well. So
Thanks.
it's interesting. I'll share a quick foot story with you as well. So in November, I started having foot pain, and I have never had foot pain. It was like I couldn't put my heel down, to the point I was going down the steps to my house on my butt. It hurt that bad. And
Wow.
I was assisting at the time in a somatic training. So I'm on the computer assisting, and I'm texting with the leader and saying, I might have to go to a doctor. I had
Wow.
no idea what was going on. But here's the funny thing, or the not so funny thing. I was in the middle of a divorce at the time, and my husband at the time was having surgery on his foot in a week.
Wow. That's unreal.
So it wasn't even just catching the symptom, there was an emotional component of
Mhm.
guilt or
Yeah.
just something being unfamiliar. I was used to being his person to help take care of him. So there was a lot of
Yeah.
emotions coming up for that, and it caused actual foot pain.
Wow. Yeah. That makes perfect sense. And our bodies will create the same symptoms other people have, just like how I had the back pain that my grandmother had. And in COVID, I had the shoulder pain that my mom had too.
Yeah.
It's like we subconsciously kind of think, oh, I don't want that thing. And then that very thing we don't want happens.
Right.
Wow. So
Yeah.
did you overcome the foot pain then through
It
the work?
actually turned into an infection, which I had to then have IV antibiotics for 6 weeks, leading right up to Christmas. So
Wow.
sometimes, even though we get a symptom and it's TMS, it can
Mhm.
lead to something physical. So we always have to still
Right.
go check. But the origin of this was complete TMS.
Wow. So how did it go from TMS to an infection?
That I don't know. That I don't
Oh.
know. But I shared, the interesting thing is, I shared with the doctor my information and I said, this is what I do for a living. And it's interesting, no one has asked me
Yes.
what was happening in my life. And she kind of looked at me like, oh, I'll take your brochure. But to be honest, I've never heard from her again. And that's okay. So tell me a little bit now, how did you decide you wanted to help other people?
I guess it was just having so many symptoms and realizing, I need to tell the world about this. In fact, it was partly due to other symptoms coming in my way that were telling me to do this as well. I would have symptoms like, I think it was the foot pain really, saying, maybe you're not stepping in the direction that you want to in life. Maybe you're not standing up for yourself in some situations. Maybe you're not putting your best foot forward. All of these great analogies. So I thought, you know what? I'm not doing that thing that I have kind of thought maybe I should be a coach. Maybe I should help people do this. I even started out kind of playing small. I started out as an EFT coach, emotional
Mhm.
freedom technique, thinking I'll just do some tapping with people and we'll just stick to that. That'll be my niche. And then I thought, why am I limiting myself? Why am I hiding my voice? Why am I not doing, sharing my full story with everybody, just like everybody else has that I've been inspired by and be a coach and do the whole thing. So it's funny, I actually started off, so I am known as How to Heal Chronic Pain on Instagram and social media, but I started off as tapping myself
Huh.
for EFT tapping. That was my name. But it's not just tapping that is going to get us better when we have chronic symptoms. We want everything. We want all of the tools. We want everything that we can use that's going to make our brain feel safe. So I didn't want to limit myself anymore. And then the foot pain I was dealing with was a true indication that this is something that I needed to pursue. So in 2021, I took my coaching certification
Mhm.
and I got my training in pain reprocessing therapy, both through Dr. Howard Schubiner and Alan Gordon as well. So that was when it all changed and I started doing this work professionally. Yeah.
Right. Yeah. So, what are some of the techniques that you use to help your clients right now when you see them?
So pain reprocessing therapy and a little bit of emotional and awareness expression therapy, which I'm going to be doing more training on this fall. Journaling, expressive writing, super helpful for clients to be getting better. And somatic tracking, which is part of this pain reprocessing therapy modality. Just really, using this body-based approach is a missing link for so many people. So many people will read the books and they'll say, okay, I believe it. And, I did that for years, but I wasn't using the body. And I know you are very familiar with using the body and having that as a healing modality. And it's, the nervous system is, always listening through bottom up and top down approaches. And when I heard that this connection in the vagus nerve is being understood 80% of the time through bottom up approaches and 20% through top down cognitive, I thought, wow, well, no wonder I wasn't getting better because I was just only doing mindset work. So knowing that I can on my own healing journey get better through somatic practices and breath work and somatic tracking and sitting with those sensations so that my brain no longer marked those sensations as dangerous, that's what healed the pain. So really allowing the sensations to be there, to be felt in the body, and changing my interpretation of them is what got me to that next stage of healing. And so working with clients, we discovered that might be something that they're missing, and we can do those on the call. We absolutely allow the sensations to be there and really find out what the resistance is. It it could be, there could be resistance in so many areas of people's lives, but we just want to find out why their brain is feeling in danger. And it could be so many things like personality traits or, living their life on high alert. So many things can make the brain feel unsafe.
Right. You mentioned a lot of tools that you used, like
Mhm.
sitting with your body, somatic tracking, journaling, breath work. And I find that, people come to me or they come to you, I'm sure, and they sometimes can get overwhelmed with all the different techniques that are out
Mhm.
there. Did you use all of them? How does that how did that work for you? Because a lot of times we put so much pressure on ourselves how to heal. And we can't get out of a brain problem the same way we got into one, right? By putting pressure on ourselves. So I'm just curious how you maneuvered that yourself, even between all those different modalities.
Yeah, absolutely. I certainly was trying to heal the same way I got into pain by being a perfectionist and doing all the things. And interestingly enough, in 2020, I was speaking with a coach, Caitlin Michaels. She no longer works in this space anymore, but she wrote to me and said, maybe you just need to chill out and watch Netflix. And at the time, that really angered me because I thought, I'm in so much pain and you're such an expert in this, and you're telling me I need to, you know, watch Netflix. But what she was really saying in that is that there wasn't one more tool that I needed. I knew everything. I'm like an encyclopedia of mind body medicine. And so it was more about kind of embodying safety. And also it's this idea that we talk about in pain reprocessing therapy that is less about the tools and more about the energy behind the tools. And so many simple things that were just putting my brain on high alert, just the way I was living in a state of flight. Just like I have to do everything on my to-do list. I have to do this, I have to do that. That was making my brain feel unsafe. So a tool is actually to just try to do a little less of that. Maybe you don't need to do, you know, 2 to 5 hours of healing modalities every day. So yes, the tools help to a certain extent, but with myself and with my clients, we all have to just kind of find our own unique recipe. We won't know that what that is necessarily right away. We just kind of have to try things on. So I still I encourage my clients to try all these things. And I never say one thing is better than the other, but what works for you might not work for everyone else. And we have to do the tools with outcome independence. So not only are we living our lives with outcome independence and, doing what we want to do in our lives despite the pain, we also, if we're using tools, we can't do them with the desire to get rid of the pain. Because then the nervous system is saying, well, there's something to fix, there's something to change. So that's a really hard thing for people to see, even that they're doing that in themselves. Yeah. So sometimes the tool could just be lowering the stakes. The tool could be watching Netflix. The tool could just be, oh, how can I make myself feel safe? So later on in my journey, I would do things like that were so simple, like lying in the grass in the sun and grounding was
Yeah.
making my brain feel safe. So I would incorporate certain things. And I encourage people to get creative with it. If you've heard breath work and somatic tracking and getting in touch with your emotions and nature, they're all good things, from a place of calmness and not trying to fix your pain, maybe combine a few things and get creative with it. So I would lie in the grass in the sun and I would do some, parasympathetic, regulating my nervous system breath work, maybe a physiological sigh. I would speak to my inner child. I would do somatic tracking and just explore and experiment. And so that kind of became my own method. And so
Right.
once we realize we have the power to do that and shift the symptoms, then it's game on. Once clients see, oh, I did that thing where I just kind of allowed the symptom to be there.
Mhm.
And I was kind of, changing my life a little bit. Yes. Now you're holding onto the steering wheel. Now you can change your neural pathways and it's just gonna keep happening.
Right. I love that. So I have a membership program called the Pelvic Healing Circle that
Right.
I go on live 3 times a week, and it's been really great. And this week we've talked about plans and how to get better. And it really has to be what I call a loose plan,
Yes.
because we can't go into this with such a structure, because then what happens is if we miss that, we're like, shame ourselves that we didn't do it, or no, I'll never get out of pain since I, didn't follow my plan. So it's just about finding a loose plan and what works for you.
Right. That is so true. Because even a mind body tool could put our brain in danger if we think we have to do it. And I had that experience with journaling. So, journaling, of course, helped me, as I said, in 2018. My pain went away, and I thought, oh, perfect. Journaling is the answer. And then in 2020, I was journaling vigorously every day, but I was repeating my tapes and I wasn't getting better and I was scaring my brain. I was not accepting the pain. Yeah, no, journaling was not the answer because I was dependent on the outcome. I needed the pain to change. And I kept on doing it every day. And then, like you said, if you missed a day, you would blame yourself and shame yourself. But that wasn't the answer. It wasn't the tool in and of itself that was the answer. It was the belief that the tool could work and knowing that the tool is meant to support your nervous system. But we can't tell and force the subconscious mind what to do. It has to sort of understand it over time. And then things start to change.
Yeah, yeah. It really is a lot about the intention behind it. So if we can pick even 2 or 3 mind body tools that we love to do because they make us feel good, that's more important than having such a structured plan.
Right. Exactly. And then you can just kind of pick off the list. Oh, what do I want to do now? What can I do next? Nicole Sachs famously says, what's the next right considered action? So
Right.
that was really helpful to understand on my journey because our nervous system shifts moment to moment. So who's to say that you won't be out of pain 5 minutes from now if you were to just go outside and go for a walk and regulate your nervous system and understand that you're safe? The neural circuit can turn on and off like a light switch. I'm sure people have seen that happen in their own bodies, especially with symptoms that are inconsistent and coming and going. And this is exactly how neuroplastic pain behaves. So who's to say it's not going to be gone in the next moment if we just try the next thing? If we just, let's do, 2 minutes of sitting with the sensation and giving my brain exposure to what it thinks is dangerous, but it's actually not, right? We just want to face to erase our symptoms sometimes. And so often, like even if a symptom were to come back, which again is not for a very long time, I might be noticing it for a couple hours. Oh, I feel that, that old familiar hip pain there. And then I'll, have this conscious awareness and say, wait a minute, I need to face it. Okay, what do I need to do? I need to accept that this is what's happening right now. And I'm going to radically accept that. And I'm going to lean into that sensation on a somatic level, allow it to be there, and really just speak to it. And that's the unwinding process, right? We're just going to face that and know that it's going to dissolve. And we're not looking at it through this, lens of danger saying I need to get rid of it. We're just looking at it and saying, yes, you can be here. And, I guess just this practice of doing this so many times is kind of how I self-integrate, right? That symptom now just integrates and then relaxes and dissipates as I just kind of feel it intentionally in that way.
So I'm just curious if you were going to leave our listeners with one lasting thing that you would like them to know about healing their chronic pain, what would it be?
Healing is possible, right? Healing is possible. We're so often denying when we're stuck in pain that we'll ever get better, but that's natural because if you've had it for years, it almost feels impossible that you could get better. I love when Dr. Schubiner says, all injuries heal and scars don't hurt. Well, so healing is possible for both, a broken arm or a cut. We know that it heals. And so the same is true for psychologically and emotionally rooted pain, which is neuroplastic pain. It heals as well in the right environment. And we just have to teach our brain and nervous system safety and create that perfect environment for healing to happen. So it's entirely possible. If you have a brain and nervous system, it is possible for you. I once thought maybe I'm different. And I remember when I found out about TMS, looking at the YouTube videos of people, because back in those days, back in our day, that's all there really was. It was like YouTube and the books. And so I'd watch these videos thinking, are they lying? Like, what are they telling the truth? Is this a scam? Is this a cult? All of these things come up that make us question it. But why are we denying that healing is not possible?
Right.
We know it's possible. And listen to the success stories. That's what we are here today. You and we're both success stories. So we know that it's possible because other people who have come before us have done it. And so, I'm rooting everybody on. You can do it. You can heal.
And just tell us, where can they find you if they'd like to work with you or contact you?
Yeah. So I'm at How to Heal Chronic Pain on Instagram and Facebook, all of your socials there. So you can find me. Instagram is where I'm hanging out most. I am on TikTok too. And so I'm always sharing resources and doing, ask me anything things and going Instagram live oftentimes. And so I am happy to connect there. And I'm available for private coaching as well. So people can reach out to me if they're confident they want some help on their journey. We can do a free 30-minute discovery call as well.
Awesome. Well, I really appreciate you coming on the podcast. I'm so glad we were able to connect, and you are a pleasure to talk to. And I am just so grateful for you being here with us today to share your wisdom with us.
Oh, thanks so much, Laura. It's been a pleasure talking to you, and I'm grateful for you too.
Take care. There we go.
Thanks for tuning in to this episode of Beyond the Pelvis. I hope it gave you something to think about, feel into, or just a reminder that you're not alone on this path. If you're looking for deeper support, check out the Pelvic Healing Circle, a live guided space with somatic practices, breath work, and a real conversation to help you feel more grounded and connected to your body. And if this episode spoke to you, share it with a friend, leave a review, or come say hi. I love hearing what resonates. Until next time, keep listening to your body and be gentle with yourself. You're doing great.